So, let me just hold at that. I will get you the update on numbers just now as soon as my information comes through. Oh, okay. Yes. So, yeah, let me just indicate the following, that the total number that has tested positive at this point is 1,505, and that indicates 43 new cases that have been recorded today. It's important to raise the fact that this number is affected by the point that I was raising about the limitations of the reactive testing that we are doing. And when we extend the testing, which is proactive, we actually expect these numbers to increase a bit more than what we are seeing here today. In terms of our projections, there is a feeling that whatever number we're seeing now would actually change as soon as we are able to go out into the community to test more people. We also want to report, sadly, 2 more deaths from KwaZulu-Natal, which one is an 8-year-old male, the other one is an 81-year-old female in KwaZulu-Natal. So from that point of view, we want to indicate that we are concerned that this number is slowly increasing, and so we hadn't reported those two more deaths. The 8-year-old male passed away on the 1st of April. The 81-year-old passed away on the 2nd. Both of them don't have a history of having traveled anywhere, and they were admitted into the hospitals in Durban. So we would like to, at this point, convey our condolences to the families and friends of those affected families, and we really do wish to indicate how sad we are about the passing of these particular individuals. We also want to thank all the health workers who are daily seized with the task of having to deal with helping to save the lives of our people. And so with that, I'd like to end the report in relation to the state of the outbreak immediately. But just to say that we also had a very interesting afternoon where we had what do you call it? Webinar? It's a video. It was a video conference. Okay, it was a video conference where we had about 10 Chinese experts who had managed the outbreak of the COVID-19 in Shanghai, particularly, and others who had been working in the nearby areas, looking at Wuhan and Beijing. And this was a cross-section of experts that were requested must come and address issues with us. And on our side, we had all the provincial leadership, the MECs of all provinces, the heads of department in all of the provinces, the Department of Health at the national level, including the Deputy Minister, as well as the Ministerial Advisory Committee, who was part of this. All in all, we counted 61 people participated in this whole conversation. And of course, we had the regional director of WHO, Dr. Mweti, Matsidiso Mweti, and 4 other experts from WHO, and the resident country representative, Dr. Kalua, and other experts. This was a very interesting and informative discussion. They took us through the whole presentation to talk to us about a number of issues, starting from the onset of the outbreak, how they had to deal with it, and in their case, in Shanghai, they're trying to limit the spillover from Wuhan city and Hebei province, and of course, they took us through the identification of the case definition, how they dealt with the testing, what sort of tests they were using, and they went into quite a lot of clinical details of the manifestation of the patients in looking at how the patients presented and how they had to deal with them in terms of screening, in terms of testing, in terms of triaging them, moving them to various parts of the healthcare system, and went into the whole question of in-hospital treatment, inpatient treatment, which is where they were indicating that about 20% of their patients had actually become very serious, and in the process, about 5 to 10% had ended up in the ICU. So amongst those who had minor symptoms, some of them would deteriorate, and so they were saying to us, most important in their management was the screening and testing early and identifying early those who could be affected, as well as also dealing with those who needed hospital care, particularly improving mortality rate at intensive care levels and so on. They took us through a number of other tests that they use and took us through quite a lot of the experience. We had probably about 15 or so of our teams who had an opportunity to ask questions, fairly pertinent questions, which actually helped us to elucidate for further information insofar as this issue is concerned. For example, there are differences between us and them in the sense that they have not had to deal with people with TB and HIV in their setting, and therefore, obviously, they'll be looking at what our experiences are. On the other side, they've also indicated what happens with the children. They didn't have too much of problems with younger people, children, and they had problems with more severely ill patients who've got concomitant infections or concomitant diseases. So we found this to be very, very informative, and we are very grateful for the support that they've given us, and we have indicated that that was the first and not the last of the interactions with them. And beyond that point, we've also indicated that we have approached the president of our country, President Ramaphosa, that we would request some reinforcement from a number of countries. I am aware that the president is already dealing with the various presidents. We had mentioned Cuba, China, and that President Ramaphosa is looking at additional support from various other countries and just looking for whatever is possible. So we have indicated as well that whilst we have down, we think it's too early to make any postulations about what should happen to the lockdown, because we think that we need a lot more data, more information that's going to show us the various trends of what is happening. But I want to say particularly to our colleagues in the health sector, we're really very grateful. We appreciate their commitment to do the work. Already we've been to various places where we've seen the enthusiasm, the preparedness of our professional staff to be able to deal with this particular case. They're fairly well informed. They are reading about this. They are consulting various people about it. So I really feel that we are in good hands. Insofar as their knowledge and their preparedness is concerned, I think we're in good cause. Obviously, the key is how do we make sure that the lockdown works so that people can reduce the spread from one person to the other. We must also make sure that we flatten the curve and make sure that when the flu season starts, we don't have so much pressure with people having to need to come to the hospital. Ordinarily, during that time, more people come with flu symptoms, more people come with pneumonias. On their own, the flu viruses cause a lot of morbidity and mortality. So with this one, we do feel that we need to be readier before that time comes.